Hi, my name is Natasha Tracy, and today is World Bipolar Day. And I'm hoping that today quite a few people can join me and we can talk about everything to do with bipolar disorder. Now, I live with bipolar disorder myself, and I actually am an expert at bipolar disorder. I've written more than 1,000 articles on it. Oh, hi, Jay Willis, joining us. Thank you. Hi, Brain Learning Center. Excellent. I do love that. Okay. So I do know quite a bit about bipolar disorder, and I also work for HealthyPlace. And as you know, this is a HealthyPlace Instagram takeover. This is their channel. So they have graciously agreed to let me stay here today and answer your questions on World Bipolar Day. So thanks so much for HealthyPlace for letting me do this. And thanks so much for all of you for joining us. I'd wave to you all individually, but there's a few of you now. I just can't. But thank you all for joining us. So I do want to start right now with a little bit about me. So I have bipolar disorder, and I can say quite honestly that it's a bit challenging during these times. I mean, bipolar disorder is a challenge at the best of times, really, and of course I think we're all not living at the best of times right now. So it's pretty tough when I feel basically anxiety in the air. That's basically how I feel. I feel like everywhere I just breathe in the anxiety. And I wrote recently that it feels like prickles. Prickles going into my lungs and going through my body. That's what it feels like to live in a time when everyone is so freaked out about a pandemic. And for me anyway, it's impossible for that not to affect my bipolar disorder. So it's upping my anxiety, of course. I think it's upping everyone's anxiety. That's the whole problem. But more than that, I think it's increasing my bipolar disorder symptoms. So that anxiety sort of comes along and almost amps up the other symptoms that I experience with bipolar disorder. So for me, primarily it's depression. So what I find is that I go along sort of in this up and anxious state consistently because of all the anxiety that I'm feeling. And then all of a sudden I'll just crash and have a really nasty bout of depression and just sort of cry and cry. And that's kind of how it feels like it's happening for me. It's like I'm able to repress the depression for a period of time and just feel the anxiety. And then the anxiety, the depression will just push forward. And then that's what I will feel, is this horrible aching depression that is so typical of bipolar disorder, but is really happening to me right now because of what we're living in. Thank you, everybody, for joining us. Thank you so much. Really nice to see new eyeballs. Hi. And I want to talk for just a second about my personal experience with bipolar disorder outside of this particular time that we're living in, so this anxious time that we're living in. And what I want to tell you is, if you haven't followed me and you don't know me, my name is Natasha Tracy, and you can find me at Natasha_Tracy_writer on Instagram. And if you don't know me, I actually have tried almost every treatment for bipolar disorder. I've tried pretty much every medication. So every antipsychotic, every antidepressant, every medication I can think of course, lithium, mood stabilizers, all that stuff. I've also had electroconvulsive therapy, and I've also had vagal nerve stimulation therapy. Hi to Jen. Hi. Jen says she's having a hard time at the moment, and I just want to do a quick call out to Jen and say, I understand. I'm sorry you're struggling, but thank you for joining us. And if you have any questions, make sure and ask. And so I've tried literally every kind of treatment you could possibly imagine for bipolar disorder. And quite frankly, I'm not doing that well. I mean, yes, I'm functional. I'm a functional adult. I have a place to live and I pay the bills and I do all that stuff. But in terms of actually being a happy, normal, I'm going to say, adult, that's a really toughie for me. I have a hard time with that. Sorry, you'll pardon me if I have to look down. I have to look down to see some of the things that are happening on the screen, just because there's so many things there. So sorry if I get a little distracted there. But thank you so much for all the love. I really appreciate it. Thank you so much for dropping by and saying that. Sketcher says they have a psychiatrist appointment today, and I just want to say, I do too. I'm doing mine over the phone, and you're probably going to do something similar, so I'll be there with you. And I just wanted to talk about, just for a second, what it feels like when you've tried every kind of treatment for bipolar disorder and you're still not at a place where you're happy with your treatment. So my name, as requested, is Natasha Tracy, and you can find me at Natasha_Tracy_writer on Instagram. And you can always look me up at natashatracy.com as well. So here's the thing. When you get to this place where it seems like you've tried absolutely everything and absolutely everything isn't working for you, it's a really tough place to be. But I do know that there is a place where you can move forward from this place. Now, I've had doctors actually give up on me, right? I've had them just say, goodbye, enough for you, no other options, go away. I've had this happen to me, and it's devastating when it happens because it feels like they're basically saying, go die. That's basically what it feels like. It feels like that's what they're saying. But I can tell you honestly that even after you've tried every drug and every treatment and every therapy and everything you can think of, there's still an other side. So on this World Bipolar Day, I just want to let you know that if you're struggling with treatment, then you're not alone. And it's not the end. And you will be able to find a provider that will help you if yours is not willing to do so. You are not hopeless, and you are not a hopeless case. You are just like me. You're someone who's having a really hard time, and that's okay. Someone says that that's where they are right now. Their body became intolerant to meds. And I just want to say, yeah, that does happen. I know a few people where basically they just, no medication, their body's not able to function on any medication. And that's a really tough place to be, obviously. Now, if I were in that position, I would definitely still consider trying small doses of recommended medications, and working with my doctor to do that, because while sometimes we're med intolerant to a certain range, sometimes a smaller range can actually be helpful, even though that's not typical, right? So maybe your average person with bipolar disorder needs 100 milligrams of a certain medication, but maybe you're intolerant at 100 milligrams, but maybe you're not intolerant at 25 milligrams. And maybe that 25 milligram dose, maybe combined with something else, is going to actually work for you. So if you are intolerant that way, don't give up. There are still ways around it. There are still ways of helping you. So I've got lots of people saying hello. Hi to everybody. Hi, waving. Really nice to see you. Lots of hearts. Thank you. And I just want to talk now, I did get a question earlier, and that was about, are there ways to actually, oh, you're very welcome. Are there ways to actually help with sleep that aren't medication related? And I actually have lots of sleep tips on my blog at natashatracy.com, because this is a question that comes up all the time. People have such a hard time sleeping with bipolar disorder. I'm included in that group. And I will admit to you right now, I do use medication, but if I just use medication alone, it wouldn't be very effective. So I need a lot of other techniques as well in order for me to actually sleep successfully. So a big part of it is what's called sleep hygiene. So it's kind of a weird term, makes you think like showering, but I think that what you need to think about of it as is good sleep practices, good sleep habits. So here some of the sleep habits that you really need to develop are sleeping in a cool room. Hi, looks like Shane says they sleep well, but the rest of the day they struggle. Yeah, that's a really common thing as well. Sleeping at night, sometimes we can do that, but then we're very exhausted during the day. And I can just tell you that sometimes that's illness related and sometimes it's medication related. So just keep that in mind and work with your doctor if you think that it may be medication related, because a shift in your medication might actually be helpful. Oh, okay. I know I got a little off topic here. BK de Boop. Sorry about that if I got that wrong. I will get back to your question. Give me just 1 second. So some good sleep hygiene habits that you can keep next to you that will help you sleep are to sleep in a cool room. A cool room is actually really, really important. Sleep in a dark room. If you can't get a dark room for one reason or another, or maybe your partner gets up at 5 and wakes you up every time, use a sleep mask. That will help. And then what I find really helpful, 2 things, is developing a routine before bed. So I know that I'm always going to do X, Y, and Z right before I go to bed. And by doing that every single night, and by going to bed at the same time every single night, that actually really helps induce sleep in my brain. My brain says, okay, it's the same time, and we're brushing our teeth, we're cleaning out the cat box, we're doing these things consistently, and it actually triggers my brain to go, yeah, it's time to sleep. And then the other thing that I do that you may or may not have thought of are blue light blocking glasses. So they're very inexpensive on Amazon. You can look them up. There's lots of brands, and they're sort of like originally for light welding. You don't have to weld. But what it does do is it blocks the blue light from your electronics. So things like televisions and computer screens and phones that actually can activate a part of your brain that says stay awake. We don't want to activate that part of the brain for, 30 to 60 minutes before we want to go to bed. And so blue light blocking glasses can actually really help with that. So they're really inexpensive. Just Google for blue light blocking glasses on Amazon, and you should be able to find a pair there. I will share some more sleep tips. I'll do an article on it to continue this conversation on my blog. But right now, I do want to get to a question. So someone, Beak to Boop, says she's feeling pressured to come out but doesn't feel ready. Are there any thoughts or advice on this? And I absolutely do have some thoughts and advice on this. When you're first diagnosed, it's a very big deal. It's not a small thing, it's not a small conversation, and it's not a small moment. It's a big deal, and it lasts a long time. And that's okay. You got some very big news, and you're going to deal with that news the best way you know how to do that. And sometimes that takes some time. So if you're not ready to tell people, that's totally okay. It's like discovering anything else about yourself. It's okay to keep it to yourself until you are actually ready to present it to another person. I talk about acceptance of bipolar disorder being a process, and it is. You accept it a little bit here, a little bit there, and then over time you start to accept that diagnosis, but it does take that time. So give yourself that time, give yourself that space, and just let yourself feel what you need to feel. Thank you. Thank you for calling me amazing. That's amazing. Thank you so much. And so basically what I'm saying is don't come out if you're not ready. The last thing you need right now is to come out and have it cause more harm than good, because right now you're dealing with something big enough. So keep your information to yourself until you're ready. And then once you are, pick someone who is close to you that, really cares about you and that you think is going to react in a positive way. And that can be anyone, but pick one person. Don't suddenly come online and announce to the world, oh my goodness, I have bipolar too. That's not how you want to let your friends and family know that you have a new disorder. You want to let people know individually, one at a time, in a conversation. And you want to pick that person, that single person who is going to be a support for you through a difficult time. And you just want to make sure that that person is going to be there for you, because you need people who are there for you right now. Being diagnosed is extremely difficult. And so while I don't think you should just wear a banner saying that you have an illness, I do think that selecting one or more of the right people is a really good idea when you're ready, because those people form support for you, and that support network is part of what's going to help you get better and part of what's going to help keep you well. Okay, so I've got someone, Megan. Hi, Megan. Rather than a question, she says she needs validation that it's really hard for us with bipolar to cope during times like this, like kids being home from school and not having enough time to do our illness self-care routines. And I would just like to say to Megan, yes, you're totally right. I talked a little bit about it up at the front, and I will say it again, which is, this time is very difficult for everyone. Now, you take someone without an illness, and it would be completely natural for that person to have a hard time homeschooling their kids, worrying about their job, feeling anxiety over what's going on, the pandemic in general, over maybe their parents getting sick, any number of things. And that's without an illness. That's totally normal. So then you transfer all of those feelings onto someone with a pre-existing illness, and holy moly, it would be ridiculous to think that it wouldn't actually make our illness worse. Of course it does. And in fact, I would suggest that anyone with a chronic illness would be seeing flare-ups right now because of the anxiety that we're seeing in the environment right now and all of the changes to our lives. One of the things I talk about as a person with bipolar disorder is the importance of routine. Routine is really important, but right now our routines are all interrupted. So that naturally is going to make things harder on us, because the routine is a coping skill we use to maintain wellness. And now it's not there anymore. And it's not our fault that it's not there anymore. It's just not there because the environment's not letting it happen. So yes, 100%, this is a very difficult time for people with any kind of illness. And yes, it's a very difficult time for people with bipolar. If I had to deal with the kind of changes that some people do in terms of being laid off or having to homeschool my kids as well, that would be pretty tough for me. I'm a single person, but if I imagine that would be a very challenging thing to do. Suddenly you go from having a certain amount of time per day, either in an office or without your kids or whatever, and now all of a sudden you don't have that anymore. That's a huge shift in lifestyle. So yes, if you're having a hard time right now, consider yourself 100% normal. Okay, so I've got another question, and this says, what self-talk might be helpful right now? Things are off the rail in my head. Okay. Again, I think that's totally normal. I'm sorry, I can't pronounce your name, but it starts with Bert. So thank you, Bert, for that question. So when things are off the rail in my brain, and that definitely happens to me, not just now, but at other times as well, certainly. When that happens, I use logic to fight my brain. If you actually decide to take a look at some of my work, you'll see that I talk about actually the difference between the brain and the mind. So the brain is that thing in your head, the organ that is sick, and your mind is you. Your mind is the you that is the real you. It is Natasha, or whoever you are. And that mind is not sick. That mind is as well as it ever is. And that mind, that you, can actually fight against your brain that is ill. So when things are going off the rails, it's because your brain is spinning. Your brain is just going more and more and more and more. And, one of the reasons for this is bipolar disorder is actually somewhat related to obsessive compulsive disorder. So we can be prone to obsessive compulsive behaviors. There is some overlap, of course. Some people do have OCD as well as bipolar, but even those who don't have OCD can experience some of those behaviors some of the time. And so maybe this is a very obsessive thing for you right now. And that would be understandable. Obsessions, when something is so prevalent, when it's in every news source, every social media feed, every conversation, it's pretty easy to obsess about something when that happens. So just consider for the moment that what you're experiencing is reasonable. Okay, that's the first thing. And don't beat yourself up for feeling that way, because you're not alone. Many of us are feeling like our brains are like a little spinning top right now. That's completely normal. Then consider for the moment that you can actually use your own logic in your mind to fight your brain, because you just said it. You said, my brain is spinning off the rails right now. What can I do? What kind of self-talk can I do? And that's because you have insight and you have the presence of mind to know that there is something you can do. So the kind of self-talk that I personally would use if I were feeling very anxious, and of course I am, is to say, look, I'm feeling very anxious right now. Anxiety is very normal right now. Everyone is feeling this anxiety right now. I'm going to give myself a minute to feel it. And give yourself a minute to feel that anxiety in all its myriad of ways. Just let it wash over you, that anxiety. Let yourself really feel it. Don't fight it for a minute. Just set a timer on your phone and say, for a minute, I am going to let this anxiety wash over me. And at the end of that minute, you're going to say, okay, thank you, anxiety. I've heard from you. I'm going to take some very deep breaths, and now I'm going to try and do something else. And thank you very much, Holly Hawktail says, accept it. And this is very much what I'm saying, which is you need to accept that anxiety is there. And once you actually get to the place where you can take some deep breaths, because I find deep breathing to be one of the most useful things when it comes to actually dealing with anxiety. Bert, hi. I'm sorry that I made you cry, but I'm very glad that you tuned in, and I'm very glad I could help you. So once you get to that point where you can take some deep breaths, then move on to something that is not anxiety provoking for you. One of the things that I will often do is I will go and pet my cat. It's a very simple thing that I can do that actually reduces my anxiety and calms me down, has nothing to do with the world outside, has nothing to do with my spinning brain, has nothing to do with bipolar disorder, and is just part of my life that actually can really help. And so that's what I recommend. And then definitely take a break from social media. Definitely take a break from the news. Try to have conversations about things that are outside of COVID-19, and just focus on things that aren't in that anxiety circle for you, and try to do that as much as possible. That's not going to be something necessarily that you're going to be able to get 100% with. That's a hard thing to do, but you are going to be able to do that to some degree, and that's going to lessen your anxiety to some degree. And I will tell you that the longer you fight the anxiety in this way, using what you know in your mind to fight the anxiety that's in your brain, the more you do it, the better you're going to get at it. And absolutely 100%, when you're in that spinning state, feel it, accept it, and then take those deep breaths. It's critical. So I've got another question. It says, do you feel pressure, stress being a voice from the community? I can see how thinking and writing about bipolar a lot could be triggering. Okay, that's a really great question. Yes, I do actually feel a certain amount of pressure being a voice for the community. I've been doing this a long time. So I've been doing this for more than 10 years, actually. And so it can be difficult to try and encompass the experience of bipolar disorder for many people in a single voice. So I try to make sure and make it clear that we all have different experiences. My experience is just mine. It's not everyone's. So I try and make sure that that comes out loud and clear, but there is still a certain amount of pressure there to actually be the one that people hear from. Yes, that is absolutely true. I don't actually find it triggering to write about it, but that's because I've been doing it so long that I can write now about all of the really challenging aspects of my life and the challenging aspects of my history. I can do that now without being triggered, but it of course took a very long time for me to get there. Thank you so much for your question. Okay, so how do I deal with stigma from my family? And this person says they get it all the time. Someone saying, you're crazy, or did you take your meds, right? And that is horrendous when someone says that to you. It's incredibly invalidating as a human being when someone says to you, did you take your meds? Look, I am me. I am not meds. I am me. And when I do something, it's me doing it. Now, certainly medication influences who you are, some of the things that you do as a person with bipolar disorder. That's why we take it. But it is absolutely 100% invalidating to suggest that the meds are at the forefront of a person. They're not. People are at the forefront of a person. Similarly, saying you're crazy. Now, saying I'm crazy is actually a thing I do all the time, but that's because I don't view it as a negative, and it's my own word. I use it. I'm comfortable with it. However, I'm not using it as an insult. And when someone does use it as an insult, it's like any other insult. It's horrible. And this one maybe is worse because they're trying to write off what you say, what you think, what you do. They're trying to write off all of you. And that's just not okay. So if you're finding in your family that this type of stigma is coming through, this type of prejudice, this type of discrimination, your own family is giving it to you, then generally speaking, hi, International Bipolar, nice to see you. It's really very good I always say education dispels these myths, because when someone is acting out like this, it's typically because they don't understand what's going on, and people fear what they don't understand. That fear then motivates all kinds of negative actions. So consider, if you can, getting some educational materials for your family, for example. Now, there are easy ways to do this. You can print off materials from a website that you like. You can get them a book that you think represents your experience with bipolar disorder. I personally have written a book on bipolar disorder. It's called Lost Marbles: Insights into My Life with Depression and Bipolar. And that book actually is very educational, not just for the person with bipolar disorder or depression, but also their loved ones. So I encourage you to pick up a book like that. It doesn't have to be mine, whichever book speaks to you. But that kind of thing, you can read it first. You can see what's in there. You can make sure that it speaks to your experience. And then you can give it to, say, your mother and say, look, sometimes when you and I talk, I feel like there's a bit of a miscommunication and I don't like some of the things that you say. But I think if you understood more about bipolar disorder, we might be able to communicate more effectively. You could say that to your mother. And then give your mother the printout, give your mother the book, whatever it is you need to do. And start with one family member. Don't have a family meeting and do a PowerPoint. Don't do that. Start with one family member and see if you can get them to take a look at some educational material and learn a little bit more. And that one person then hopefully will respond positively. Pick the person who's going to respond the most positively. Pick them first. And then they're going to be your champion. right? They're actually going to go forth and say, I learned this amazing stuff from this book or printout, and I've been treating my daughter or son or whomever. I realize now that I haven't been treating them very well, and they're going to be your champion with other family members. So education is really key. And if for some reason you've tried education, you've tried talking to people, and you absolutely can't get through to them, and yes, I know there are people like that in that situation, then you're going to have to look at putting up your own boundaries. Because quite frankly, if having an interaction with someone is negative and hurtful for you, it doesn't matter who and it doesn't matter why. That's something you need to consider creating a boundary around. Okay, so I know we have another question. I'm going to have to find it though. Just one second. Okay, so Bipolar Solutions. Bipolar Solutions says, I'm looking for ideas around coping strategies for Facebook Live. I'm doing later today. Do you have some coping strategies? Well, it depends on what you mean by coping strategies. If you mean that you're feeling a bit anxious about it, yeah, I get it. That's totally understandable. My stomach was feeling anxious before I started today. Totally okay. But here's the thing about Facebook Live or Instagram Live or whatever. It's just about being yourself, right? So hopefully, once you get going a little bit, you'll calm down and you'll start to be yourself a little more, because that's what people want to see. So, your bipolar symptoms may act up because you're going to be live and you're going to be people watching you, and there's going to be people asking you questions, and it's all a little bit much, let's say. But that's when your bipolar coping skills come in handy. So that's when you want to do things like try to quell the anxiety as much as you can. We talked about anxiety earlier. So deep breaths are really important when it comes to anxiety. And even if right now, in the middle of my live session, if I was feeling a lot of anxiety, I would take a minute and I would take a deep breath, because that lessens anxiety in the moment. It's going to lessen it before you do something anxiety provoking, and it's going to lessen it during. And you shouldn't feel ashamed of that. You should not feel ashamed if something you need to do is take an extra 2 seconds in your life. Everybody's going to understand that. And then also try to have a backup plan when there's something really anxiety provoking for you. So for example, if you're doing what I'm doing right now, which is a Q&A, consider what would happen if no one asked any questions. What would you do? And the answer to that is, have topics ready, have things printed out if you need to, that you can go to and say, this is what I'm going to talk about for 15 minutes or for 5 minutes or for 3 minutes. And if your live session doesn't work out like you want it to, that's okay too. You can say in a live session, thank you very much for joining me. I really appreciate it. And then you can end that live session, and that's okay. These are reasonable things to do, especially when you're battling with a mental illness. You're battling with something that's harder than your average everyday person is going to do. And if your audience is other people with bipolar disorder, they're gonna get it. Okay, so it looks like we have passed our half-hour mark, and I just keep talking. It's it's definitely one of my downfalls. I want to thank everyone for joining me today. Thank you so much. Someone just said I'm the best. Thank you so much, Bipolar Solutions. I just want to say that you can find me on Instagram at Natasha_Tracy_writer. Tracy has no E, by the way. And you can find me at natashatracy.com. And I also write a blog for HealthyPlace, and it's called Breaking Bipolar. And my own blog on my own site is called Bipolar Burble. So quite frankly, I guess you can find me everywhere. So feel free to look me up and hit me up with some more questions. I don't mind at all. Also at HealthyPlace, I'm going to be doing an interview this afternoon with the bipolar señorita. Daleen is her name. We're going to be doing an interview at 6 p.m. on Eastern Time or 3 p.m. Pacific. And We are going to be discussing everything to do with stigma because Daylene actually is Hispanic and she's going to talk Latino, and she's going to talk to us about what it's like to have bipolar disorder in that community, what that's like for her, what she has faced, and how she deals with it. So do tune in then. It's going to be on the same channel. I'm going to be talking some more. And you're going to be able to ask your questions again. So that's at 6 p.m. Eastern, 3 p.m. Pacific, and hopefully I will see some of you then. Thank you so much for joining our live session. You guys stay safe, wash your hands, and have a good day.